Hi, everybody. Welcome. So happy to have you today. I am Courtney Lucas, one of the volunteers, and I am very happy to introduce Madison Brown. So, Madison is a public education coordinator with the Alzheimer's Society of Brant, Haldeman, Norfolk, Hamilton, and Halton. And she also holds a degree in gerontology from McMaster University with an additional certification in long term care and retirement home management from Mohawk College, and she is also a GPA certified coach. And those for you who don't know, GPA is gentle, persuasive approach. And Madison has previously worked as a recreational manager and educator in retirement, long-term care, and dementia care homes. And she is passionate about enhancing the lives of those living with dementia. We're very happy to have Madison with us today. And go ahead with your presentation.
Thank you so much. Nice to see you all this morning. I appreciate you having me today. So today we are going to, as said, talk about recognizing and identifying brain changes as we age. So our agenda for today, we're going to quickly look at memory and the brain to understand in really simple terms how it works. We'll go over what dementia is and then how to understand the difference between normal aging and not normal aging, and then what you can do if you're concerned about any brain changes. So I promise not to get nitty gritty here. I'm not a science person myself, but I think it's a really great idea to have an understanding of the way things are working in our brain. So if you were to hold your two fists together, that would make about the size of a human brain, and it weighs about 3 pounds. And the brain works essentially because it has billions of neurons that are talking to each other through all the connections that are built between the brain connections. So, for example, if you were to speak a word that you are reading on a page, the information would be sent from your eyes to the back of your head at your occipital lobe to be processed, and then it would be sent back up to the front of your head to your frontal lobe to be understood. And then your primary motor cortex above your ears is used to speak. So that's a really good example of how a really simple action is utilizing a lot of different areas and connections of the brain. So, of course, we're relying on all of those connections to be able to do everything. In order to stay healthy and function well, all of these neurons in our brain need nutrients and oxygen. So we always say that what's good for the heart is good for the brain. All of the different areas in the brain have different tasks, and they are all working together to complete every task, movement, and piece of communication. So, in general, when we look at memory, there are three main steps to how it works. We start with acquisition. So, we receive some sort of information from any of our five senses. And then we move to storage or disposal. So, there's a part of our brain that will decide whether or not that information is important enough to keep. And if not, it'll just throw it away in the garbage. If it decides it's important enough to keep for later, it stores it away just like a file in a filing cabinet, so that when we try to remember that information later, we can just open the drawer, pull out the file, and access that information. So this is a cross section of the brain. So if you were to slice it and look at it like a piece of bread, this is what it would look like. So the hippocampus that you can see labeled there, that is the area of the brain that decides what to keep and what to throw away. And all of the little folds and gooey gray matter that you associate with the brain, that is the outside layer of the brain. It's called the cerebral cortex, but usually we just call it the gray matter. Most of our higher thinking takes place in this outer layer of the cerebral cortex. And all of the information transfer happens on the inside in the white matter. That gray matter on the outside layer will naturally thin as we get older. So, just as we expect our bodies to change, as we age. We don't expect to be able to do the same things we could do when we were children. We have to expect that our brain is going to change a little bit as well. So, what is dementia? I always include this because it's really important that everyone has just a basic understanding of what it is we're talking about. So, dementia as a whole is not a disease. It is a set of symptoms that reduces a person's ability to perform everyday tasks. Dementia is an umbrella term for that set of symptoms. And underneath that umbrella, we have different types of dementia. Currently, the Alzheimer's Society recognizes that there are over 120 different types or causes of dementia. Here you can see listed the 5 most common types under the umbrella, and together these 5 types of dementia make up about 95% of all cases. So we have Alzheimer's disease, which is the most common. It makes up about 60 to 80% of all cases of dementia. We have vascular dementia, which makes up about 15% of cases. Lewy body dementia, which makes up about 10% of cases. Frontotemporal dementia makes up about 3 to 5. And then we have mixed dementia, which is exactly what it sounds like. It's when someone is living with 2 or more types of dementia at the same time. Most commonly, this is Alzheimer's disease and vascular dementia, but it could be any types of dementia. And then above the umbrella, I have mild cognitive impairment, or MCI. So an MCI is not considered to be a dementia. It could progress to a dementia, it could stay the same, or it could improve, and it all depends on the cause of the mild cognitive impairment. When someone is living with a mild cognitive impairment, we might expect to see brain changes that are more than what we expect with normal aging. However, with appropriate supports, the person can continue to live their day-to-day life successfully and independently. So some of the symptoms that we commonly see when someone is living with a dementia can include memory loss. Of course, this is the most common symptom of dementia. About 95% of people living with dementia have memory loss. We might see difficulties with attention. So for a person with dementia, they might have less of an ability to filter out all of the information that's coming in from their senses and focus on one of those pieces of information at a time. The person might have increased difficulties with problem solving. And these could be really big things like doing your taxes, or smaller things like what do I want for dinner? And small problems can seem big and overwhelming to the person. We often see changes with language or communication, and this can include words as they're spoken, heard, read, written, and processed in the brain, or a combination of any of those. And we often see within this maybe difficulties with word finding, maybe using words incorrectly, misinterpreting what is being said, or reverting back to a mother tongue if someone speaks more than one language. We might see changes in mood and behavior. So for example, if somebody was previously very extroverted and outgoing, we might see a shift where they suddenly become more withdrawn and isolated. Or vice versa, we might see someone who has always been a bit quieter suddenly become much more outspoken and active. Essentially here, any change that is different from the person's normal. We might see changes with the person's vision, and this is different from physical changes with the eye, like cataracts or glaucomas. We're looking at how the brain is able to process and understand the information from the eyes. So for example, a person with dementia might experience a change in their peripheral vision. So right now, myself, I could see a full 180 degrees all the way around me. I could see what's happening beside me without turning my head. But a person who's living with dementia might experience a decrease in their peripheral vision to something that would seem like maybe a scuba mask. So they have lost the ability to see what's happening beside, above, or below them without physically turning their head or their body to see what is there. And we might see differences with the person's balance and movement. So this is related to a person's ability to understand where parts of their body are in relation to other things. So the person's understanding of distance might change, for example. They might bump into something when they're walking because they don't realize that they are as close as they are, or perhaps when they go to sit down on a chair, they get right on the edge or they sit on the arm of the chair because they don't have a good understanding of where their body is in relation to where they are trying to put it. There is no sequence or typical set of symptoms. The symptoms that each person living with dementia will experience is going to be completely different and individualized based on the type of dementia they have, but also just on all of the other factors that that person is experiencing in their life. We always say if you've met one person with dementia, you've met one person with dementia because everyone will experience it completely differently. Okay, so let's talk about what changes might look like and how to understand what is normal aging and what might not be normal aging. So I'm going to go through 10 possible signs of dementia. And as we do, we'll talk about what is normal aging and what is a possible indicator that something else might be happening. As we go through, please do keep in mind that these are signs that might flag a potential issue and are not meant to diagnose a dementia, does not mean you have dementia if one of these things are happening. It's just a little indicator that something might be happening. So first we have changes in mood, personality, and behavior. So everybody has days when their mood is up and other days where your mood is down. And that is completely normal. But what might not be normal is more inexplicable mood swings, heightened emotions, suspiciousness, acting really differently than what is normal for them. We have those problems with language. So with normal aging, we absolutely expect that there will be maybe some occasional word finding problems. It's when the word is on the tip of your tongue and you can't find it, and then it comes to you at 3 in the morning when you're laying in bed. For my Oma, my grandmother, she would go through the names of all the other grandchildren and the family pets before she finally came to my name, even though I'm absolutely the favorite grandchild. I swear. But what might not be normal is if these problems with language are happening significantly enough and frequently enough to impact everyday life and everyday conversations. So if the person is consistently using a word incorrectly without recognizing that mistake, if they are having real trouble comprehending the meaning of words or phrases, and remembering that we are not including any problems understanding that are associated with hearing loss. So if a person is experiencing hearing loss and they're having difficulty understanding what you're saying, that of course is not necessarily an indicator of dementia. It might just be related to the physical changes in their hearing loss. Difficulty performing familiar tasks. So we absolutely all make mistakes once in a while, but in normal aging, this is usually due to inattention. So I take the wrong turn on the way to the grocery store because I wasn't thinking, and suddenly I'm driving to my church instead of the grocery store because I just went into autopilot. What may not be normal would be forgetting how to do something you've been doing your whole life. So if you have been preparing a lasagna in the same way for 40 years and suddenly you have difficulty remembering what the ingredients are or the steps to put it together, or maybe you suddenly don't remember how to change the tires on your car and you've been changing your own tires from summer to winter every year for your whole life, that could be a sign that there is something else going on. Misplacing things. So usually, again, this is due to inattention. I definitely misplace something at least once or twice a day. You misplace your library book, but then you find it under the couch because you were laying on the couch the last time that you were reading it and it got stuck in the cushions. But what might not be normal would be placing items in locations that don't make sense. So perhaps that library book is in a kitchen drawer or in the linen closet. And then when the person finds it, they don't remember putting it there and maybe blame someone else for having been silly enough to put it there in the first place. Problems with abstract thinking. So processing speeds do slow down with normal aging. So you have probably heard the expression, you can't teach an old dog new tricks. You absolutely can. It just might take a little bit longer. And that's okay because we expect that with normal aging. So learning new things, decision making, problem solving can all take a little bit longer. But with not normal aging, we see changes that are more in line with not understanding how to use these cognitive abilities. So maybe not understanding what numbers are or how they're used. Maybe the person has always done their own banking, balancing their checkbook, managing their finances, and suddenly have real difficulty being able to navigate those processes. Next, we have a loss of initiative. So I'm sure everybody has had days where they just want to lay on the couch and watch TV in their pajamas, and that is completely normal and absolutely encouraged. But what might not be normal is starting to have these days more than once in a while. It is becoming the norm, and that's a significant change in the person's lifestyle. So this loss of initiative is related to a symptom in dementia that we call apathy, which is a lack of drive or emotional expression. Disorientation of time and space. So with normal aging, again, that disorientation is usually the result of inattention. Oh, it's 2:30 already. Where did the day go? Or again, taking a wrong turn while you're driving and ending up in the wrong spot. But what might not be normal would be not knowing when in time the person is. So really losing track of maybe the time of the month or the season or the month in general that they're in, or perhaps getting lost in a familiar place. So if I take the wrong turn because I wasn't paying attention, but I see where I am and I can turn around and go back, that's fine. But if I am suddenly unsure of how to get to the grocery store and I've been driving that same route for years, or maybe I find myself having difficulty remembering how to get home, then that could be an indicator that something else is going on. Memory problems that disrupt daily life. So with normal aging, memory issues are primarily about retrieving memories. So the memory is in there, that file is in the filing cabinet, but we have just a bit of a harder time accessing it. So we might forget an appointment, but when reminded about it, we remember that we did have that appointment. And again, inattention can come into play here. But with not normal aging, these memory changes are related more to encoding issues. So putting the file in the filing cabinet and making sure it stays there. With this type of memory change, the person might not have any memory of making that appointment in the first place because the brain didn't file it away. So this is why people with dementia might start to repeat questions or stories or statements, especially with Alzheimer's disease. One of the first areas of the brain that is often impacted in Alzheimer's disease is the hippocampus, which is the part of the brain responsible for putting files in the filing cabinet. And that's why we see that memory loss occur as one of the earlier symptoms. Challenges understanding visual and spatial information. So with normal aging, you recognize objects, you see them when you're looking at them, you can understand depth changes, like when you're climbing stairs or moving from carpet to hardwood floor. You understand how to navigate those spaces. But with not normal aging, a person might not recognize familiar objects that are in front of them, or they may walk cautiously from a tiled floor to a carpeted floor because the change in color might seem like a change in height for them. Perhaps they think they need to step up or down, even if it's a flat surface. Or they might misjudge how close or far away something is. Maybe they put a glass of water right at the edge of the table where it could fall because they don't recognize how close to the edge of the table it is. And then we have impaired judgment. So everybody absolutely has made the occasional unwise decision. We've all done it. You can keep your secrets to yourselves. I won't ask. But with not normal aging, we're looking at making decisions that are really out of character for the person or maybe put others at risk. So for example, maybe not recognizing a medical problem that needs attention, or going out on a day like today wearing a winter coat and hat and gloves because you don't recognize that a day like today warrants very light, breathable clothing and lots of water. So all of this being said, based off of these 10 possible signs, if you are concerned about any brain changes that might be happening with yourself or someone you know, there are 3 kind of main things that you want to do. 1, talk to a doctor. And in that, you want to pay attention to your health. So what are the changes that you're noticing? When are they occurring? How frequently are the changes happening? These details can help to inform a physician as they determine the cause of these changes. If you go to a doctor and you just say, I'm worried about my memory, that doesn't give them a ton of information to go on. They're going to want more information about exactly the changes that you're experiencing. So asking other people around you if you're comfortable, or bringing someone close to you with you to the appointment, or vice versa, you can offer to go with another person if they're the one that has noticed the changes, so that you can offer as much information as possible to assist in that process. And you can reach out to the Alzheimer's Society, of course, with information and support. As part of the process of getting a diagnosis for a dementia, there is currently no single test that can tell if a person has dementia. Remember when I said that there are over 120 different types or causes of dementia. And they are all physically happening in a different way in the brain. So there, of course, can't be a single test that can pinpoint all of those different types of dementia. So you can't just do a urine or a blood test. Getting a diagnosis can take time. And the diagnosis is made by eliminating all other possible causes. A diagnosis can be made with your family doctor, at a memory clinic, in the hospital, in the community. It all depends on where geographically you're located and what's available in your community. If you are making an appointment to discuss these changes that you're noticing, it might be a good idea to let them know that you would like longer than that typical 5 to 10 minute appointment that we often get at the doctors, because they will address one concern in a visit and then they need to move on to someone else. So if you feel like it might be a little bit more timely, then share that ahead of time so that you don't feel rushed through the appointment or the process. So the doctor will go through a medical history. They'll ask questions like, what symptoms have you noticed? When did they first appear? How have they changed over time? What other medical conditions exist? What medications are being taken? Is there a family history that you know about, etc.? A physical exam and laboratory tests may also be completed. And they are going to be looking for any other possible cause of what could be causing those symptoms. So for example, something as simple as a deficiency of vitamin B12 can cause some symptoms that might appear as though they are a dementia. So the person will need to have all of those other possibilities eliminated. The doctor might perform or make a referral for a cognitive assessment. Doctors will do this themselves. Some will refer to a different physician, a memory clinic that will do them for you. Brain imaging cannot be used to diagnose a dementia. It might be ordered to help eliminate other possible causes for the symptoms or the changes that the person is experiencing. Finally, very last thing, I'm going to go over the Alzheimer's Society programs and services that are available. So all of the programs and services offered by the Alzheimer's Society are free and accessible to everybody. You see here our main pillars of support. So starting with support and counseling, this is available for persons living with dementia, care partners, family, friends, anyone who's involved in that journey. And our wonderful counselors host support groups as well, which is an amazing opportunity to be in a space with other people who are going through shared or similar experiences, and offer a great opportunity for some peer learning as well. Our education is available for everybody from the person living with dementia to the people around them, community groups, healthcare professionals, first responders, etc. Our education is available virtually and in the community, depending on, just the month that we're in and what region you're in. So there's always something that's available that we can point you to. Health and wellness programs are offered in the community and virtually. We have exercise programs, art programs, and social programs. These are intended for a person living with brain changes and a care partner or a family or friend. And then finally, information and referrals. So we have lots and lots of resources and information that is available if you're looking to learn about a topic related to dementia or brain changes. We're able to assist with system navigation and finding different supports and services in the community that might be helpful to you. It can be very difficult to understand what to do or where to go within our healthcare system. And we're able to offer some guidance with that. And we also have behavioral supports as well. So if a person is experiencing some changes that cause changes in behavior that they are having difficulty understanding or supporting, then we do have staff that are in their roles specific to helping to understand and come up with some possible solutions for those changes to help the person to live in a more supported and successful way. Here I have our contact information. So this phone number, it's a 1-800 number, and you can be directed to the office that is closest to you. We are a large organization covering from the top of Halton all the way to the bottom of Haldimand and Norfolk counties. So if you call this number, you will be directed to your office in either Burlington, Hamilton, Brantford, Simcoe, or Hagersville. You can also reach us online. I've included my email there as well. If anyone has any questions after today, or you're looking to be directed to any resources or supports that I've talked about, you can also reach out to myself directly. Thank you very much for having me today. I really appreciate your time. And like I said, please feel free to reach out to myself or to the Alzheimer's Society in general if you have any questions. It's one thing that I always like to say is it's really important that even if you don't know what question you need to ask, even if you don't know what specific support you need, you can reach out to us and we will guide you in the right direction. So we don't want that to stop you from reaching out for support. We will make sure that we get an idea of what it is you're experiencing and provide whatever resources and supports we think would be best appropriate for you. So thank you very much for your time. I appreciate it.